ECF that is sitting here. So the ECF compartment has expanded. The osmolarity, we had added more solutes here. These could not go in, but water moved out. That caused the relative concentration of the solutes to increase here. So osmolarity over here increased as well. Please remember, it's the osmolarity which would become same. Water would move accordingly, whichever direction it has to keep the osmolarity the same. So this is how you can actually calculate. You can pick up 5% glucose, you can pick up 0.9% sodium chloride, 3% sodium chloride, and so on. You can pick up those molecules. The important thing for you to know is, if it is sodium chloride, use the periodic table, understand what is the 1 moles gram quantity, and from there then you can actually calculate everything else. So this was just a quick example of how you can assess that what is going to happen to the patient's body compartment, so the person's body compartment, as a result of infusing something. So now think about it. If I was a doctor, which I'll be sorry if I would be doing that, if I'm a doctor who says, well, I just added 2 liters of water, 1 of that liter is going to go in the ICF and the other is going to stay in the ECF, and I'll have 1 liter equally distributed to each side. That's not going to happen. You just saw that we actually pulled, as a result of infusing this fluid in the body, we actually pulled another 3 liters from intracellular fluid to the extracellular fluid. So if you're a doctor and you're trying to move fluid from one compartment to the other compartment, what would you do? You'll play this game. You'll decide what type of solution to be added to the body. For example, if you want the fluid to be moved from here, from the ECF to the ICF, give the patient plain water. Plain water has lesser osmolarity, we'll talk about it in a second, has lesser osmolarity, so the water is going to come in and move to the ICF. That would rehydrate the ICF. Remember, ICF is dependent upon the ECF, or whatever goes into the ICF goes through the ECF. And most of the time the things actually end up in the vascular compartment first. From there they equilibrate with the interstitial compartment, then from there they would equilibrate with the ICF compartment. So this was a quick example. I'm going to move on. We will now start talking about the tonicity. And again, this diagram is over here. We have to understand what do we mean by tonicity and what is the effect of that. So let's do this. Let's say this is our so this is ICF, this is vascular compartment, this whole compartment is ECF, right, and this is interstitial compartment. So the question is, what is the idea of tonicity? What do we mean by tonicity? So what we mean by tonicity is, as we saw in our previous examples, the osmolarity in the body fluids is about 280 milliosmoles. Any fluid which also has the same osmolarity is said to be isotonic with the body fluids. The tone or the tension or the osmotic pull or osmotic pressure in that fluid is going to be the same as this. What does that mean? So let me say I have a beaker here. In that beaker I have some water, and this is, let's say, 0.9% sodium chloride, which would be 280 milliosmoles. So some sodium is present here. Right? So this solution has the same osmolarity as the body, so this will be called isotonic. What does that now mean? What that means is, if I picked up a little RBC from the blood vessel and I moved it in here, this RBC would live fine in that fluid, provided that we have the other nutrients over there. But the environment of the RBC inside is going to be isotonic to the environment of the fluid. So there is no change in the osmolarity, there is no change in the concentrations, so fluid is not going to move in or out of the RBC. So net water movement is going to be 0. So this RBC as it was here is going to be there. On the other hand, if I pick up some fluid, so I'll leave that over there. Let's say I have another beaker in which I have hypotonic solution. Hypotonic. Hypo means less, tonic means tension. So the tension of this fluid is lesser than our body. So let's say the milliosmoles here are 140 milliosmoles. So concentration of particles is such that the total milliosmoles over there, or total osmolarity is 140 milliosmoles. Now what's going to happen? If I pick up the same little thing, the RBC, and move it in here, inside the RBC, the osmolarity was 280 milliosmoles. RBC is a cell as well. It has a cell membrane too. So inside the RBC, the osmolarity is going to be the same as is the osmolarity in the remaining system. So the RBC has 280 milliosmoles. What does that mean? It's a concentration unit, right? So 200 milliosmoles would mean, 280 milliosmoles will mean more concentration of solutes as compared to 140 milliosmoles. Correct? What does that mean? Where is the more concentration of water? Outside is water in more concentration. So what's going to happen? Water is going to start moving into the RBC. So very soon this RBC is going to swell up with the water. And depending upon the osmolarity change, this RBC can burst as well. Correct? So when we have hypoosmolar or hypotonic solution added, that risks our cells because they would have water moving into them. The reason is that their osmolarity is higher than the hypoosmotic solution added. And depending upon the hyponess of that fluid, how hypo is that fluid, depending upon that, enough fluid can go into the cells that it can damage them. Now let's see one more case. Let's say we talk about hyperosmolar solution. So what does that mean? That has much more concentration of particles as compared to the isotonic solution. So let's say the osmolarity here, let's say this is ocean water. So we've been so fond of the ocean water and we're carrying our own ocean water with us. Let's say this is 2000 milliosmoles per liter. So this is a very high number. In this, if once again our poor experimental RBC, if we put that over here, what's going to happen? So RBC comes in here, sits down, it is 280 milliosmoles inside, outside is 2000 milliosmoles. What does that mean? Where is the concentration of volume more? Inside the